study suggesting there's a surge in the amount of antipsychotic drugs prescribed to teens and young adults. The drugs help to alleviate symptoms in some disorders, but evidence on their safety and effectiveness is mixed right now. In particular, this was worth noting, doctors are using the drugs to treat ADHD, a condition for which those drugs are not approved. Joining us now, Dr. Chuck Williams, educational psychologist and director of graduate studies at Lincoln University. So, Dr. Chuck, I know you're critical of this, and we'll go through some of the reasons for that. But I'm curious, what is the thinking in the medical profession about why this would be a good idea to prescribe any antipsychotic drugs to someone that is, let's say, age 12?
Jenna, you took the words right out of my mouth. You know how I feel about this. We should not prescribe medications to children unless we absolutely have to. And what's key to this study, which was conducted in 2010, is that we have nearly 7 million children, Jenna, in this country who are being prescribed antipsychotic medication for disorders like ADD. And guess what? Antipsychotics were not designed to teach attention deficit disorder. But what may be happening is if a drug that is somehow designed for ADD, like Adderall or Ritalin, doesn't work, a health professional may decide to try something else to see if it could benefit the young person. But 7 million children taking antipsychotic drugs is a problem.
And so this new study looked at data going back to 2010. They looked at prescription records for 2006, 2008, and 2010. What is the risk of giving a drug like an antipsychotic drug, any antipsychotic drug, to a still developing body and brain?
Well, if you talk about very young children, and guess what? There are very young children, millions of whom who are taking these drugs, being prescribed these drugs, and I hope mothers and fathers are watching and they learn to say no to drugs, prescription medication drugs for their kids. The brain is still developing. In this study, the largest cohort sort of using these psychotic medications for ADD were adolescents. So biological maturation is happening, important neural connections are being made, self-development, identity. So these things can be significantly interrupted when you introduce these psychotropic medications. Not only can they affect mood, but they can actually change, Jenna, the physical structures of the brain, and that's not a good thing.
I want to talk to you about that, because one of the things that the study also showed, and again, this data that they looked at ended in 2010. So they looked at all this different data, but there's still new data over the last several years. That's how they got to these conclusions, and saw that boys were getting the antipsychotic medications more than girls. When you're on a medication like this, Dr. Chuck, you can't just stop cold turkey, can you? That you actually have to go through a process of withdrawing from the drug. And the reason why I mention that is because we've heard of many cases where there have been adolescents or young men who have gone violent, and some suggest that they recently went off their medication. Is that part of this conversation that we should be having?
Yeah, and that's the problem I have personally with big pharma and these large pharmaceutical companies and these physicians who unethically collude to prescribe these medications for disorders like ADD, when we can use cognitive behavioral therapy techniques, mindfulness, meditation. You know, I talk about diet and exercise. See, the problem is, again, these drugs are not designed to address ADD. These are antipsychotic medications. But the other big problem, which I mentioned, is not only does it take a while for these drugs to take effect in terms of being efficacious, but you can't just stop without dealing with some terrible outcomes, like making kids suicidal, making them depressed, making them anxious. So it takes a while for them to work, weeks, and then it takes weeks or months for them to wean themselves off. So to a certain extent, from the beginning, because of these drugs, these kids, in a sense, become addicted.
Wow. It just speaks to the power of the drugs as well. Dr. Chuck, we wanted to cover this just to give parents a heads up. It was very interesting data and worth noting. Thank you very much. Always great to have you on the program.
Thank you as always.